Hello, good afternoon, good afternoon, good afternoon, good evening, or good morning, depending on your location. You are welcome to today's program. All right, welcome to today's program. Uh, we shall be talking about signs of uncontrolled diabetics. Okay, we shall be discussing signs of uncontrolled diabetics, and again, due to popular demand, I will be mixing the topic. Okay, I will be mixing the topic all together. You are welcome. You are welcome. While I'm trying to get myself ready, I shall be. How are you guys? All right. While we are waiting for everybody to join the program, we shall be discussing the signs of uncontrolled diabetics. I'm going to be discussing two topics at the same time because of time constraints. I shall be discussing two topics at the same time. So I'm going to be in and out. I'm going to be interchanging between one topic to the other just to make sure we are meeting the demand. Due to popular demand, there's a topic that I discussed before, and then people want me to discuss it, to revisit it again and discuss it. So that is why, all right, I'm going to be discussing two topics at the same time. The first topic is going to be signs of uncontrolled diabetics. We shall be discussing those signs. Or even if I did not say anything, I believe you guys know what I'm talking about. Signs of uncontrolled diabetics. You guys know what I'm talking about. All right. But I'm going to be making two topics. I shall be discussing two topics at the same time today. Okay. So just want to let you guys know what I shall be doing in the next hour. So how are you guys? I'm waiting for everybody to join the program. We shall be discussing signs of uncontrolled diabetics. That is what I shall be discussing today. How are you guys? How are you guys doing? All right. How are you guys doing today? Too many questions for me here. I'm gonna visit them. Let's wait. Let me wait. While I'm getting ready, let me just wait for 5 minutes. I want more people to join the program, and then we'll start. Okay. So just be patient with me. I'm looking at. All right. Okay. So how are you guys doing? Can somebody talk to me? Sorry, excuse me. I hope I'm trying to make sure everybody join the program before we start. All right. Grace, you are welcome. I'm doing good. I hope you are doing fine also. Nice to see you. Nice to see you. All right. Okay. We shall be discussing signs of uncontrolled diabetics. I believe, even without me saying anything, you guys know what it is. If I put a test now, and then I say, can you guys write me the signs of uncontrolled diabetics? I know you guys are going to do very well in it. Okay, you guys are going to do very well in it. So we shall be discussing that signs of uncontrolled diabetics. So I'm going to discuss them one after the other, and from there, and then we'll move on to the next. I'm trying to see. I'll try as much as I can. Okay, so let's go. Muhammad, you are welcome. You are watching from Ghana. Grace, I'm doing fine. Thanks for asking. Fully recovered now, ready to roll. So we shall be discussing what are the signs of uncontrolled diabetics. For those that have been following me for a long time will know the answer to this. Okay. For those that have been following me for a long time will know the answer to this. The signs of uncontrolled diabetics. Let me see something here. Just a minute, please. Let me go and see. Just hold on. I'm trying to. All right. Okay. So when we are talking about signs of uncontrolled diabetics, all right, people with diabetics, if you don't control your diabetic situation, as I said yesterday, those that followed me yesterday, if you don't manage your sugar level or control, let me use the word diabetics. So when I talk diabetes, you guys understand what it means. If you don't control your diabetics, and when I talk about diabetes, I'm talking about your sugar level. So that's all you are required to do is to control your sugar level. If you don't control it, it becomes uncontrolled diabetics. All right. And then it comes with consequences for not controlling your sugar level. What are the reasons why you are not controlling your sugar level? Is a question you have to ask yourself. Okay. So people with diabetes who have difficulty managing their blood sugar levels may experience symptoms. Okay. There are symptoms accompanied to your uncontrolled diabetics. All right. So it is important you control your sugar level at all times. Because when you fail to control your sugar level at all times, it becomes uncontrollable. It's going to be uncontrolled. As time goes on, it's going to become uncontrollable. And when it becomes uncontrollable, it goes with stages. Okay, it goes to stages. It might be to the severe stage or to the end stage, which is going to be very difficult to be controlled. And that comes with the severe consequences that could even cost you your life. So now, let's look at, excuse me, tiredness. There's something I was eager to say. Okay, once you don't control your sugar level, it makes life difficult for you. Quality of life remains very poor. Like yesterday, I was saying, if you control that issue of diabetics right from day one, you get hold of it and control your glucose level constantly, it keeps it within that target range. Okay, you will live a normal life with somebody that is not diabetic. You don't have anything to worry about. You don't have anything to worry about complications of diabetics, anything, because you are very serious to control your sugar level and keep it within the target range. Now, if you fail to control your sugar level, what happens? The quality of life becomes difficult for you. Okay, because now your sugar level keep rising. Okay, and once your sugar level remains high, it can also be a life-threatening issue. So now, quality of your life becomes difficult. One, you will be uncomfortable. One, stress. Two, depressed. Three, sick from one sickness to another. Okay, this sickness today is going to be, oh, my leg today. If not your leg, it's from your eyes. If not because oh, I cannot breathe, or all of a sudden you become hypertensive, or all of a sudden you develop low blood pressure. All of a sudden you have a cholesterol issue. So quality of life becomes low and uncomfortable. Okay, that is why yesterday I say it is important for you to learn how to recognize the symptoms of diabetes, so that as soon as you recognize those symptoms of diabetes at the early stage, you should be able to treat it immediately, get hold of it, treat it immediately, so that you prevent the complications that accompanies it. So that is one thing. So we're going to look at what are the signs of uncontrolled diabetics. We're going to look at the signs. You guys know the signs already. Okay, so let's look at the signs of uncontrolled diabetes one after the other. Okay, and the question I'm going to ask is that we're going to answer this question. Okay, first of all, we're going to answer this question all together. I'm going to share the question. Why are some diabetics uncontrolled? Okay, Chamberlain, you're welcome. Ruth, you're welcome. Okay. My A1C yesterday come to 5.8 and my friend is 6.2. Any advice? Your A1C came yesterday 5.8 and my friend is 6.2. Both of your Ruth, both of your A1C level is okay, so there's nothing to worry about. Okay. Your A1C level at 5.8 is even better than your friend that is at 6.02. Okay, so both A1C level 5.8, 6.6, 6.02, they're all okay. So if your A1C level is at 5.8, it's even much better than 6.02. But at 6.02, it's still okay, even better. All right. So both A1C level are okay. Ruth, I believe I've answered your question. Okay. Ruth, I believe I've answered your question. Now, Salia from, you're welcome. All right. So we are trying to answer this question. Why is some diabetics uncontrolled? Before we go to the signs of uncontrolled diabetics. Okay. Now, there are several reasons. There are several reasons why someone's diabetes remains uncontrolled. Okay. There are several reasons why your diabetes remains uncontrolled. As I said yesterday, it differs from individual to individual. Like for instance, now Ruth posted a question, says her A1C level yesterday is 5.8 and your friend is 6.02. Now, both numbers are okay for A1C level. But you could see that the person that has an A1C level of 5.8 is much better than 6.02. Both of them are diabetics. Okay, but you could see that it varies in terms of numbers. All right, so there might be a reason why her A1C level is 6.02 and then yours is 5.8, 5.8, 5.4048. Okay, so the same thing applies to why, because we are trying to answer the question, we are trying to answer this question: why is some diabetes remain uncontrolled? Before we go to the science of uncontrolled diabetes, who is in here now? Neka, please, can you give Neka a round of applause? She's not late. She's always a late comer. Today she's early. Let's clap for her. Today she's early. All right. Welcome. All right. Yesterday she's not here because I didn't notice her yesterday. She's not here yesterday. Now we are trying to answer this question together. Yep. All right. So we are trying to answer this question together. Why is some diabetics uncontrolled? Suzanne, you're watching from South Africa. Ruth, my friend is not under medication. Okay, so if your friend is not under any medication and then her A1C level is at 6, it's fantastic. It's okay. Okay, as I've said it several times, it is not mandatory that you must be on medication to have control your diabetics. There are thousands of people who are not on any medication and they are living healthy without no issues and they are controlling their diabetics. So if your friend her A1C level is at 6.02 and she is not in any other medication, she's doing okay. And then your own is 5.8. At 5.8, maybe you are under medication, but 5.408 is much better. Okay, if your A1C level is at 5.408, it's okay. Both numbers are okay. Both numbers are okay, all right? But you are at 5.48 and she at 6.02. So both numbers are okay. So there is nothing to worry about whether she's on medication or not on medications. There are different factors. Okay, there are different factors why her A1C level is at 6.02 and yours is 5.48. She might be having, there are different things. Age plays a role. Underlying illnesses also plays a role. Okay, so there are different things that her own is a little bit 6.02, yours is 5.48. But at the bottom line is that both numbers are okay for A1C level. All right, so that is the bottom line. Both numbers are okay for A1C level. Now let's try to answer this question. Okay, why are some diabetics remain uncontrolled? Remember, we are discussing signs of uncontrolled diabetics. Now, but before we go into that, dealing with the signs of uncontrolled diabetes, let's answer this question. Why are some diabetics remain uncontrolled? All right, Haji, you're welcome. Haji Keduta from Sierra Leone, you're welcome. Brian, you're welcome. All right. So, why is some diabetics remain uncontrolled? As I said, there are different factors. It differs from individuals to individuals. Okay? The reasons differs depending on individuals. There are different factors that are going to be taken into considerations why as some diabetics remain uncontrolled. One, okay, insulin plays a role. Use of insulin. Okay, insulin is one. If you are insulin dependent, okay, if you are one of those that depend on insulin to control your diabetic situation, that can be a reason why you are not controlling your sugar level, because you are not following your doctor's guideline properly. If you are not following your doctor's guideline and you are insulin dependent, that could affect your diabetes to remain uncontrolled. Okay, because you must follow your doctor's instructions. Okay, in terms of the guideline of using insulin. Okay, now Treatment also plays a role. Okay, treatment also plays a role. And what do we mean by treatment? Okay, the same thing in terms of doctor's guideline. I'm being specific in terms of insulin. Doctor might prescribe you the amount of dosage of insulin to use, either you inject or use pump. So if you are not following the direction of that particular use of insulin, or doctor give you to use this particular insulin, you are not using the full dosage of the insulin correctly, it might affect your sugar level to remain uncontrolled. Now, treatment also plays a role, okay, in adjustments to your treatment in terms of medications. Either you are not taking it correctly, or okay, maybe when they say take two medications every day, take two medications a day, you take one medication instead of two. Or some days you take two, the following day you don't take, you forgot. Or you go some days without taking your medications. Those can also cause your diabetes to be uncontrolled. Okay, so those things plays a factor. Now let's leave about drugs and medications and doctor's guideline as a factor that will make the diabetes to remain uncontrolled. Let's go to out of those areas. Let's look at your lifestyle. Your lifestyle plays a vital role if your diabetes is going to remain controlled or uncontrolled. And when we use the word lifestyles, we talk about the generality of what you eat, what you drink, your exercise. If you are physically active, are you reducing your weight or you are increasing your weight? All those things plays a vital role while your diabetes remain uncontrolled. For instance, if you are not eating healthy, okay, if you've not changed that habit, when they say stop eating this type of food, and you go home, you say, okay, the doctor is not here, so the doctor is not going to know what I'm eating, and you still go back to eat that your favorite food, instead of staying away from those food, you still consume them, is going to affect your diabetes to still remain uncontrolled. So your lifestyles, what you eat, what you drink, the quantity and the quality matters a lot. It's going to affect managing your sugar levels very well. So there's a possibility it's going to remain uncontrolled. Even here, while we are discussing diabetics, a lot of people have complained they are on that medication for 2 years. Still, each time they go on a test, their sugar level is high. That has to do with your lifestyles, okay? And it remains uncontrolled because you've not yet mastered the art of dieting. Instead of dieting, physically exercising, you are not exercising, okay? And then you are not wary of calories. You keep eating food that contains a lot of calories. So instead of you reducing your weight, you are adding more weight. All those things fall onto lifestyles, and they are going to make your diabetes to remain uncontrolled. So that is why you see some diabetics remain uncontrolled in terms of doctors' prescription guidelines, okay, and then your lifestyles. All those things matters. Then now age is the third factor that also contributes why your diabetes remain uncontrolled. If you are in the 30s, 40s, 20s, okay, you can control you might have the energy, okay, to control or listen, comprehend advices, doctor's instruction, and control your diabetes, compared to your father who is in 80s, 70s, 80. The more they get older, the more they lose their sense of reasoning. Okay, so it's going to be very hard for them to understand the advice of a doctor to say, this is what you are going to eat, this is the quantity to eat, abstain from this. They need help to guide them through. Because if you have a father or a mother that is in the 70s, 80s, he's going to find it very difficult to understand doctors' guidance on what to eat and what not to eat, the quantity and the quality, at what time and at what not what time. Even in terms of medication, they find it very difficult, okay, to take the proper medication. So that is why they need help. So if you have a parent that is in the 70s, 80s, they need constant help. They need a helper with them all the time to guide them through on what to eat, and then in terms of their medication. So age plays a vital role why some diabetes remain uncontrolled. Okay, so we have Kabaye from Lesotho. Okay, from Lesotho. So you're welcome. So these are some of the reasons why some diabetes remain uncontrolled. Now let's look at the signs of uncontrolled diabetes. we're going to go into deeper the signs why your diabetes remain uncontrolled. Okay, I believe you guys know the answer already. I know if I put a test now, you guys are going to pass because you guys know the answer. If you have uncontrolled diabetes, you know what it is. What are the signs? One is hyperglycemia. We all know what is hyperglycemia when your sugar level is high. That is high blood glucose. If you have uncontrolled diabetes, the first thing that is going to happen is that you're going to be an elevation in your sugar level in the bloodstream. You're going to have too much high blood sugar in your bloodstreams constantly. It's going to be piling up, and keep building up because you're going to have constant sugar buildup in your bloodstream if you have uncontrolled diabetes. Okay, your reading is going to go high drastically because you are not controlling it or you've given up in controlling your sugar level. So the one sign of uncontrolled diabetes is high blood glucose. Okay, so if you don't control your sugar level, your blood glucose is going to keep piling up, going to keep building up to an extent that is going to, and the more it builds up, the more it damages your organs and your arteries, your blood vessels, and your nerves. Yesterday, I gave you guys an illustration. I gave you guys an illustrations on how too much sugar in your bloodstream damages your organs and your arteries, your blood vessels. Okay. When you have too much sugar in your bloodstreams, they are not supposed to be floating around in your blood. When your sugar level is high, as soon as it crosses that threshold and goes high, your brain sends a signal to the pancreas to release insulin so that it's going to get rid of that excess sugar in your bloodstreams. So that excess sugar is not supposed to be floating around in your blood. It's supposed to be driven into the cells of your muscle, tissues, fat, and liver to be stored in there to be used as fuel. That is the essence of the excess sugar. So once it crosses that threshold, the brain is going to send a signal. Now there's too much sugar, get rid of it. Now, when the insulin is released, it's supposed to gather those excess sugar and drive them into the cells, tissues of the muscles and fat and liver and store them there. And then now you can use it as fuel that you need as an energy to do most of the things you are doing. Now, whilst those excess sugar are still floating in your bloodstream, you cannot classify them as fuel. Rather, they become harmful to your health because those excess sugar become harmful. All they do was to start damaging all the organs and tissues in your body. And that is why you develop diabetes, because now your pancreas is not functioning or producing enough insulin that you required to get rid of those excess sugar. So the first symptoms of uncontrolled diabetes is that you build up high glucose level. All right, you build up high glucose level. David, you are welcome. Toby, you are welcome. Toby, this is the first time to see you here. Where are you watching me from? Okay. Patricia from Guyana, you are welcome. Toby, this is the first time for me to see you here, but you are welcome to the community. But where are you watching from? All right. So now you will all understand that the first sign of uncontrolled diabetes is high glucose level. That is the first sign of uncontrolled diabetes. Now let's go to number 2. Okay, number 2 is frequent infection. Frequent infection. If you have uncontrolled diabetes, you're going to develop infection. And I've told you guys, infection also sparks up your sugar level constantly. That is why you have to avoid infection. Okay, so once you have uncontrolled diabetes, you have frequent infection. High blood sugar level can increase a person's susceptibility to infections all the time. And when you have an infection, you have to see a doctor to start treatment immediately, because the more infection remains in your body, your sugar levels still keep going up. Okay, and it's going to take a longer time for you to recover from wounds and other cuts. So once you have that constant infection, wounds are not going to heal properly. It's going to take you a long time to recover because you have a high glucose level in your bloodstreams. Okay, so now what type of infection are you supposed to develop if you have your sugar level uncontrolled? Let's look at the type of infections you're going to develop. I don't want to share it. All right. 1, you're going to develop skin infections. If you have uncontrolled diabetics, I said number 2 is frequent infection, but now we are not discussing what type of infection. Number 1 is skin infections, okay, such as ulcers, especially in the feet, foot ulcers. Okay, it starts like abrasion. We call it abrasion on the feet, or a kind of blister, or a small dot. You could see a tiny dot with darkening. It's going to be very dark. You know your feet. Everybody knows their body very well. You know your feet, and you could see a small black dot just on top of your feet or on the side of your feet, and you'll be wondering, what is this? That is how the foot ulcer starts. When you have too much blood sugar in your uncontrolled diabetics, it's going to start like a dot or a blister or abrasion on your feet, on your foot. There's something we call cellulitis. Okay, there's a skin infection we call cellulitis. Okay, cellulitis can also develop in your skin. So skin infection, cellulitis, or ulcer, foot ulcer is one example of an infection that can occur if you have uncontrolled diabetes. Now let's go to number 2. You have the UTI. We know, you guys know what is called UTI, urinary tract infection. Okay, including okay. So you guys know what it's called UTI, urinary tract infection. Example of urinary tract infection is something we call cystitis. Cystitis is an example of UTI. Okay, so Marilyn, you're welcome. Okay, so we are looking at specific infection that can occur if you have uncontrolled diabetes. We said number 2 is constant infection, and we are looking at specific infections that can occur if you have uncontrolled diabetes. And I've listed number 2 as UTI, urinary tract infection, and cystitis. We have something we call cystitis. It's an example of UTI, can occur. All right, can occur. Ivy, you're welcome. Marilyn, you're welcome. Now let's look at, in fact, okay, let's I wrote it down, but okay, Marilyn, you are welcome. Okay, Ivy, you are welcome from Botswana, and Nalu, you are welcome from Zambia. All right, now let's look at just hold on. I'm trying to okay, I've posted it there on the comment section, so you guys can go along with me. Okay, so you guys can go along with me when I'm talking about it. It's on the it's on I appreciate it. Thank you very much. Appreciate it. Appreciate it. Okay. All right. Okay. So it's on the comment section. Okay, you guys can read along on the comment section there. All right. So number 2 is UTI. Remember, we are discussing a specific type of infection that is going to occur. Remember, we said number 2, we are discussing a frequent infection. If you have uncontrolled diabetes, we've discussed number 1, high glucose level, and we are at number 2, which is frequent infection. Now we are discussing specific type of infection that can occur if you have uncontrolled diabetes. And then we say UTI, urinary tract infection, and cystitis is an example of urinary tract infections. That is why I posted the five type of infection on the comment section there, so you guys can go through it. And then we have the gastrointestinal infection. Okay, you have the large and the small intestines, so you could have gastrointestinal infections. Okay, and we have number 4 as respiratory tract infections such as flu. Okay, can also call respiratory tract infections such as flu, can also call, and then you have the yeast infection. Women will understand what is yeast infection. Example is thrush. Okay, so those are the type of specific infection that can occur and reoccur if you have uncontrolled diabetics. Okay, so number 1 is high glucose level. Number 2 is frequent infection, as if you have uncontrolled diabetics. We are discussing signs of uncontrolled diabetics. So number 2 is frequent infection, and then we discuss the specific type of infection in the, which is on the comment section there. There are 5 in there that are listed. Okay, so so you guys have to make sure you avoid making sure that your diabetes is not uncontrolled. Okay, especially the diabetic foot ulcers. Okay, that foot ulcer can lead to tissue death and possibly lead to an amputation. That nothing scares me, okay, like that foot ulcer. Okay, I've seen it. I've seen people with foot ulcers, and I know what they go through because they fail to control their diabetics. That can lead to tissue death and finally amputation. Okay, so that is why you have to make sure you check your skins and food all the time. If anything that looks foreign to your body, keep an eye on it. Note the date and time you notice it, and then keep an eye. If there's any changes in terms of size, enlarging, then go and see your doctor immediately. The earlier, the better. Do not wait for later. So if there's any foreign thing you see in your body that is unusual and you're diabetes, write the date and time you notice it, and then keep an eye on it. If there's any changes in terms of enlargement or getting big, then go and see your doctor. The earlier, the better. You have to check your food all the time, and then your skins must be checked. Check your skin all the time. Don't just go to the shower or when you are changing your clothes. You don't know. Check your skins all the time. And I've advised you guys in terms of how checking for your mammogram in terms of women. Make sure you check your mammogram all the time. Do not just wait. You go to the hospital, oh, they say you have a breast cancer or something like that. There's a lump in your breast. No. Do your due diligence at home. Before you take your shower, when you're changing your clothes, make sure you check your mammograms. To make sure there is no anything foreign, like a lump in your mammogram, feel it. If you suspect anything, ask your husband, ask your daughter, ask your boyfriend to feel it, to see, are they feeling the same thing you are feeling? If it's too suspicious, then go and see a doctor. The earlier, the better. Okay? So these are the things you're supposed to do at home. So let's go to number 3. Okay, you're welcome. Patrice, you're welcome. So Obede, Yama, you're welcome. This is the first time to see you in our community. You're welcome. Thank you so much from Edo State. All right, you're welcome. You're welcome from Edo State. All right, you're welcome. So let's go to number 3. Let's go to number 3. Increase urination. Okay. Malawi, you're welcome. Peter, you're welcome from Malawi. All right. Okay. Okay, I forgot to share something before we go on the link. Sorry, I forgot to share it. If you want to join the program live, anybody that wants to come on the live video while I'm here, ask a question or contribute or share their experiences living with diabetes, use that link. There's a link I posted now. Open it in your browser, in your phone, download it, and then follow the instruction on how to. It's going to bring you in here, and I'm going to bring you in. So anybody who wants to come in live, you use that link. Open it in your browser, download it, and then follow the instruction on how to join the live video that I'm doing right now. So number 3, we are discussing number 3 is increase urination. Increase urination as the 3rd signs of uncontrolled diabetics. And this particular increased urination, among all the signs of or symptoms of diabetes, this is one symptom that is noticeable for the first time if you're diabetic, or even when your sugar level increases, even if you're diabetic and all of a sudden your sugar level increases and your urination changes, then you should know that your sugar level is high. Okay, this is the among all the symptoms of diabetes, increased peeing or urination is one symptom that you can notice there's something wrong with you. When all of a sudden you are rushing to the washroom every minute, every seconds to be peeing, you know that, okay, my sugar level is high. I'm going to check it. Or I have to go and see a doctor to find out all of a sudden I'm peeing all the time, or I'm wetting the bed all the time. Or you have a child, a daughter, or an elderly parent that all of a sudden start with bed wetting the bed, then know that something is wrong. You have to go and see a doctor when the urination frequency changes. So we all know about, okay, increase urination. And we know that people release about 1 to 3 quarts of urine daily. Okay, so in case of untreated diabetes, a person may release up to 20 quarts a day. You know, I ask you guys, a healthy person, if you are healthy without diabetes, normally in a day, you're supposed to urinate 1 up to 4 quarts. That is 4 times in a day. That's a healthy individual that is not diabetics. But when you become diabetics, instead of 3 to 4 times a day, you goes up to 20 or more than that. So when that happens, that you are peeing all the time, then know that something is wrong. Okay, let me share this with you guys. So what I'm trying to say here is people with diabetics, okay, people with diabetics release about 1 to 3 quarts, okay, of urine daily, okay, sometimes up to 4, maximum is 4. A healthy person urinate about 4 times a day. Then if you have diabetics, okay, it gets up to 20 quarts or more a day. So when your urination has exceeded more than 4 times, then know something is wrong with you. You have to go and see a doctor. Okay? When you've urinated more than 4 times in a particular day, then know something is wrong with you. So as I said, this increased urination is the only symptoms among other symptoms that you can notice that something is wrong with you and you need to go and see a doctor immediately. Okay, so I'm not going to waste much time on this. We all know about increased urination. Let's go to number 4. Number 4 is frequent thirst or increase in thirst, drinking a lot of water. Okay, when you are diabetics, okay, you will experience extreme thirst. Okay, you experience extreme thirst. You drink a lot of water because you are losing fluid. Okay, now when your blood sugar is high, this is how your body works. Because why you have to replace those fluids is for you to avoid dehydration. Now, what happens is that when your sugar level is high, you are peeing a lot. When you are peeing a lot to get rid of those excess sugar. Now, in the process of getting rid of that excess sugar, your body is at the same time losing fluid with that excess sugar. And because you are losing the excess sugar and at the same time draining your body of excess fluid, you have to be drinking a lot of water to replace that fluid you are losing so that you don't become dehydrated. Okay? Okay, so that is why you are drinking a lot of water, because you are getting rid of that excess sugar through urination. So that excess sugar is going out, and then there's also a fluid, that is excess water, going at the same time with the excess sugar. So you are losing a lot of water, and because of that, you are drinking a lot of water not to be dehydrated, to replace the fluid that you're losing. Okay, so that is what happened. You are increasing your thirst. Now, somebody says, let me see what Brian says. Since diabetes is hereditary, are my 12-year and 8 years old kid at risk, even though I gave birth to them years ago before I was diagnosed with type 2 diabetics? Brian is asking a question. Brian is asking a question. I believe you guys can read that question with me. He says, since diabetic is hereditary, my 12 years and 18 years old kids at risk, even though I gave birth to them years ago before? Yes, yes, yes. The answer is yes. Okay. As long as I don't know, because he says since diabetic. I don't know if you Brian is diabetic. I don't know if you are diabetic, because your question did not say you are that. It says since diabetic, you are asking a general question, so I don't know if you are diabetic, but diabetes is hereditary. And I've given you guys example of me. All right. I use myself as an example. I'm diabetic, controlled. Okay. Okay. You say you're diabetic. So the answer is yes. Brian, the answer is yes. All your children, even your grandchildren, even the children of your two kids are also at risk. Even the children of your unborn children of your two kids are still at risk. Okay, of getting diabetes. And this is how it works. Okay, Brian, these your two children, these your two kids, the 12 and 8 years old, their children that is yet unborn are at risk of being diabetic. That is why it's hereditary. Okay, so I gave you guys example of me. In my family, I think I've told you guys this story before several times. In my family, it's a diabetic family. Okay, it's a diabetic family. In my mom's side, they are all diabetic, right from my great grandfather up to my mom. They are diabetic. In my dad's side, it's glaucoma in the family, eye problem. Now, I gave you guys an example. My mom is diabetic. My mom is diabetic. Now, this how it goes. In my mom, the dad of my mom has 10 children. The dad of my mom has 10 children. On the whole 10 children, none of them get diabetic except my mom. The grandfather of the dad of my mom is diabetic, died of diabetic. But the dad of my mom is not diabetic. I don't know if you guys are understanding. The granddad, the father of the dad of my mom died of diabetic. But the dad of my mom is not diabetic. Now, the dad of my mom have 10 children. Among all the 10 children, none is diabetic except my mom. All right? Now, listen. In my family, we are 4 siblings. We are 4 siblings. I'm talking about me now. My mom have 4 siblings. Out of the 4 siblings, none is diabetic except me. So you see how it goes. You see how it goes? The dad of my mom died of diabetic. The dad of my mom escaped it. It's not diabetic. Now, the dad of my mom have 10 children. And all the 10 children is my mom that is unlucky to be diabetic. Now, in my own side, we are 4 siblings. Out of the whole 4 siblings, I'm the unlucky one that is diabetic. Others are free. That's how it works. So everything is by luck. So, Brian, you are diabetic. Your 2 kids might be lucky to escape it. Your 2 kids now that you have might be lucky to escape it. They will never be diabetic. But when they born children, one of your children, I don't know if you understand that, Brian. I'm trying to explain to you how it works. Your two kids now that you have are at risk of developing diabetes. One of them might be diabetic, or both of them might be unlucky to be diabetic, or at the same time, both of them might escape it. They will not be diabetic. And then they born children. Then the children they're born, one of them might be unlucky to be diabetic. So it's by luck. So that is how it goes. So I hope I've answered your question by giving you guys an example how it works. So let's go to what you said again. In 2002, I was pre-diabetics, and in 2024, I became diabetic. In 2022, I was pre-diabetic. Okay, in 2024, I became diabetic. My parents are not diabetic. Will they inherit it even though I gave birth to them in 2000? Yes. Yes. In 2022, you were pre-diabetic. You should have stopped it. If you have in that 2022 that you were pre-diabetic, that is when you should have reversed it. Because when you are pre-diabetic, you can still stop that diabetic from becoming full diabetic. So 2022 that you know you are pre-diabetic, that is when you should have stopped it from progressing to full diabetic. You should have reversed the trend by changing your diet, stop eating those food, the things you are eating. You should have changed your diet, exercising, and start eating healthy food. You should have reversed it, and then you might not be diabetic today. So because you see, in 2022 you were pre-diabetics and you could not change your lifestyle, and you allow it for 2 years. Now you become diabetic. So you miss the opportunity. You have 2 years. You have 2 years. You should have reversed the trend and be free of diabetes today. But because you did not do your work properly, it developed type 2 diabetes. Now, your children, your grandchildren, the children of your children are exposed. They can be, any of them can be diabetic. As long as you are diabetic, that's what they call it, hereditary. As I said, your two kids now might be lucky, one get it, or both of them get it, or both of them escape it, not being diabetic. But when they start having children, one of their children might be diabetic. That is how it goes. Okay? So that is all. Even their children might not be diabetic. Maybe the children of their children become diabetic. All right? So once it's in the family, it's in the family. So, so what you have to start, Brian, what you have to start doing now is to start teaching your children how to eat healthy food, avoid sugary drinks. You have to start teaching them not to be drinking Coke. Make sure they don't be buying ice cream. Oh, daddy, I want ice cream. No. Since you know what it is, you have to start from the childhood now to start educating them on why they should not be taking sugary drinks like Coke, Fanta. Every time when they cry, you go and give them Coke. When they cry, you give them Coke. Or daddy, I want ice cream. Or daddy, get me biscuit. All those things contain sugar. You have to start now to start teaching them, changing their brain to avoid sugary items. When you make tea for them, make sure there is no sugar in it. Even if you're going to give them sugar, make sure it's very, very, very small. So now is when you have to start teaching them, so that by the time they grow up older, they will know, okay, you know what? I don't like sugar. Don't give me anything sugar. I don't want Coke. I don't like drinking all these sugary items. I don't like ice cream. I don't like all these biscuits. You have to start now bringing them up in the way they can avoid sugary items. All right. I believe you guys understand my explanation to Brian's questions. Okay. Now we are discussing about number 4, signs of uncontrolled diabetes, and I say increased test. Okay, because I've explained to you guys why you are drinking a lot of water. Because when you are getting rid of excess sugar through urination, you're also losing fluid. And those fluid and the excess sugar you are losing makes you to be dehydrated. You have to drink water so that you can keep yourself hydrated. Now, high blood glucose can result in dehydration, as I've tried to explain, and it also can reduce. You can also reduce your body's ability to absorb water, because you are losing fluid constantly. So it's going to reduce your body ability to absorb water. Okay. Now, when you have excessive thirst, drinking a lot of water, and also you are having a lot of urination, you are more likely, okay, you are more likely to have your sugar level rise above 250 milligram per deciliter. When you are drinking a lot of excessive water, a lot of water, and you are urinating excessively, okay, that means your sugar level is in the range of 250 milligram per deciliter. All right, it becomes too much that you become so excessive that you're drinking a lot of water. Now, to avoid dehydration, you have to drink a lot. That's why you're drinking a lot of water. And because of that, your bodies can have reduction of ability to absorb water. Okay, and a person experiencing increased thirst, okay, also have experience dizziness, and also chronic dry mouth, because you are losing a lot of water. Your mouth is going to be very, very dry. When I say dry, you can't even see a saliva in it. All right, and again, overwhelming water after eating. You see, after you finish eating, you drink about a bucket of water. So that is why you have increase in thirst. Samantha, you're welcome. Samarita, you're welcome. So increased thirst is the fourth sign of uncontrolled diabetics. Okay, that is the fourth sign of uncontrolled diabetics. Now let's look at number 5. Okay, DKA. All of you know what is called DKA. That is diabetic ketoacidosis. Diabetes ketoacidosis is called DKA. It's a life-threatening emergency that can rise when the body cannot access glucose for energy. Now, when you have DKA, your body ability to access sugar is limited. Okay, and it's life-threatening. Remember, I said you need that your sugar, you need it as a fuel. It's hard to combat it as a fuel, and that fuel is used as energy. When your body's ability to access sugar is limited, that you cannot even gain access to sugar, it's the life-threatening emergency, and then your body starts to break down fat. And once your body starts breaking down fat, there are some ketones that are very dangerous that's released to the body. Those ketones are the one that is life-threatening. That is the byproduct. We call them ketones. They are the byproduct. And that byproduct is very dangerous, that can lead to life-threatening situations, because now your body is not ability to access sugar, so it has to break down the excess fat that is in your body, the good fat. And once in the process of breaking down those excess fat, the good fat in your body, it releases those byproducts, called them ketones. Those ketones are the ones that are life-threatening. Okay, they are byproducts. They are life-threatening. And as they accumulate in your blood, they become so toxic. Once they accumulate and build up, they become so toxic. And that is why it becomes life-threatening. So avoid diabetes ketoacidosis, which is call it DKA. So once you have uncontrolled diabetes, you might experience DKA, and it's life-threatening. And what are the symptoms of DKA? One, abdominal pain. Okay, abdominal pain. You have vomiting, nausea or vomiting, dizziness, and then you have your breath. You have a smelling breath. Okay, because of the buildup of those ketones that becomes toxic and acidic in your blood. So these are the things you have to be worried about. Okay, do you have any question? Do you have any question? Seeing a 1-2 question here. I don't know what this guy is. I can't read your question. What you are telling me here, I can't read it. Do you guys have any question? So these are the symptoms of DKA, diabetes ketoacidosis. Okay, those are the symptoms of DKA. And when you are at this stage, you need a serious medical attention. It's not something you have to treat at home. You have to be taken to an emergency hospital to be treated because it's life-threatening when you have DKA. Okay, so it's on the comment section there. Oh, 20 minutes because I have 20 minutes to finish up. Do you guys have any question? It's like all of you have gone to sleep. No, I can see everybody's gone to sleep. All right. I have about 20 more minutes to go. So let's look at number 5. What are the signs of uncontrolled diabetes? Number 5 is appetite. Your appetite increase. You eat a lot. Okay. Your appetite increase. You eat a lot without a weight gain. Okay, hunger, these are the symptoms of diabetes. You eat a lot because you cannot control your craving here. Everything that passes by, you want to eat. So when you start eating a lot all the time, you eat this food, any food that passes by, you want to eat it. Okay, if you know that you are eating too much, then that is a sign of uncontrolled diabetes because that urge to eat is there. You are eating all kinds of food. Anything that passes by, you must eat it. That is a sign of uncontrolled diabetes. Okay. So even though, and why do you eat a lot? Even though you have high blood glucose level, okay, why do you eat? Even though you have high blood glucose level, your cells cannot have access to glucose to use as energy. That is why you eat a lot. The essence of that food you eat that contains carbohydrate is to be converted as a fuel that you can use as energy. Now, even though that your glucose level is high, okay, still your cells cannot have access to glucose to use as energy. Okay, this happen. Why does it happen? Nube, how are you? Nzube, how are you? Okay. So why is it that even though that your glucose level is high, at the same time, your body cannot access glucose to be used as energy? Why? Remember, your appetite to increase, hunger, you are eating a lot. Now you are eating, but you're not gaining weight. You eat all kinds of food, but you're not gaining weight. Why are you eating? Because one, your glucose level is already high. Now, your body, your cells cannot have access to that glucose to use as energy. Why again? Why? Because your insulin is your body needs insulin. Okay. Now, what happens is that because your body does not produce enough insulin to be used to regulate the amount of sugar in your bloodstreams, or remember the function aspect of it, your body cannot use the excess insulin that your body produces to regulate the amount of sugar level in your bloodstreams. So there are why. One, you are eating, you have uncontrolled diabetes, and you are eating a lot. You are eating a lot, you are not even gaining weight. Upon all the food you are eating, you're not even gaining weight. Now, your blood sugar is already high. But at the same time, the cells in your body cannot have access to that food because in that food, there's carbohydrate to be used as energy. Your cells in your body cannot have access to that glucose that your body needs to use as energy. Then why? Because the cells in the body, your body cannot produce enough insulin, or your body is overproducing insulin, but it doesn't know how to use correctly to regulate okay, the excess sugar in your bloodstream, because it has to be broken down first, and again, it has to be driven into the cells to be stored to be used as fuel for energy. So that is why you keep eating. But the irony is that you are eating all those food, you are not getting weight. Now you are eating all those food, still the cells in your body cannot even have access to that food to be used as energy. Now the cells are not producing enough insulin, or is overproducing, but it doesn't know how to use it correctly to regulate the amount of sugar in your bloodstreams. That is why you keep eating those food all the time. Okay. Now, okay. Yeah, I'm going to answer this later. So let's go to number 6, weight loss. Weight loss is number 6 as a sign of uncontrolled diabetes. Samarita says, I have changed my diet and taken my medication, but my sugar is still high. You change your diet, you are taking your medication, but your sugar is still high. The reason why your sugar is still high because your dieting is still poor. The reason, Samarita, even though you change your diet and you're taking your medication and your sugar is still high, 2 things. Your dieting is still poor. You are not still eating the correct 2 things. In fact, let me make it 3 things. Your dieting is 1. You are not still eating the correct healthy food. That is 1. 2, you are not counting your carb. In that food you are eating, there's too much carb in them. And that is why that food is not healthy. You have not started eating healthy food, balanced diet. And again, in that food you are eating, the carbs in them is too high. That is why your sugar is still high. And 3, you are not yet exercising, you are not physically active, you are not exercising. So these are the 3 key things while your sugar is still high, Samarita. Your dieting is poor, you still not yet eat the correct diet, healthy food, and in that food you are eating, there's too much carbs in them. You are still not counting the carbs rightly, and because there are too much carbohydrate in them, it affects your sugar level, even though you're on medication, because too much carbohydrate is going to spike up your sugar, even though you're taking medications. So you're going to balance your diet, eat healthy, and count the carbs very well. Now, eating healthy, it means you're going to eat more fiber food and the less carbohydrate. When your food is too much carbohydrate and less fiber, it's going to affect your sugar level and even your medications. It has to be more fiber and less carbs. So your dieting is very poor. You have to make sure you get hold of your dieting, eat correctly, eat healthy, count your carbs, and exercise to get hold of your sugar level in the right order. Okay? Deal with your dieting. I believe, Samarita, I believe I've answered your question. Ogi, you're welcome. Diane says, I lost weight because I changed my diet about 10 pounds. Correct? Okay. So that means you are doing the right thing by eating the right food, eating the right quality food. The quantity matters a lot, and then you are counting your carbs. You are reducing your calories. You are not eating too much calorie food. So that is why you are getting results. So keep it up, Diane. Keep it up. So Samarita, as I told you, dieting is very important. Count your carbs is very important for you to get access to control your sugar level. Your dieting is very important. You must diet properly. Dieting is very important. Okay. Okay. All right. Johanna, watching from Namibia, you're welcome. All right. So 6 is weight loss. 6 is weight loss. Okay. The signs of uncontrolled diabetes is weight loss. Your body's inability to absorb glucose can lead you to weight loss. your body's inability to access glucose, okay, to access or absorb glucose can lead you to weight loss. Okay, so if your body, like what I explained in the previous one, your body must have access to glucose. Despite you are trying to control the glucose level in your bloodstream, your body must have access to glucose. That glucose is what you need as a fuel to be used as energy. So if your body ability to access glucose is limited, it's going to make you to lose weight. So whether a person with diabetes loses weight depends on how well the body uses glucose and how much that person eats. Okay, it may also be reinstated to say that eating too much is not advisable. That is why I've advised you guys to eat in a smaller portion. But your body must access glucose, and that is why I've said in several times that any food you eat that does not contain carbohydrate, it is never a balanced diet. It must contain carbohydrate. The question now is that carbs must be 15 grams of carbohydrate. You must not exceed 15 grams of carbohydrate per meal. It is very, very vital because you need carbohydrate for your body to function properly. That is what is being converted as fuel. So your body's ability to access glucose is vital. And once your body inability to access glucose will also make it to lose weight. So that is why, all right, when you have unnecessary weight loss, can also count as symptoms of diabetes. Because when you are urinating, losing fluid, okay, that can impair you to have weight loss. So weight loss is a sign of uncontrolled diabetes. Okay. So do you still have any question? Joanna, this is your first time to come in to see you today. Welcome to the community from Rundu, Namibia. You're welcome. You are welcome. Do we have more questions? Now, these are the type of food. Let me see if I can share one. All right, these are the type of food that is supposed to be eaten. For those like Samarita, okay, these are the type of vegetables, okay, you're supposed to be eating. These are some of the vegetables, the type of vegetables that you are supposed to be eating. Okay. So that's what I say. For you to get, you have to eat more fiber and less carbohydrate. These are the type of vegetables that you're supposed to be eating. Let me share another one. Let me see what I have here. Okay, so we have this one here. You can see that you see your vegetable here. You could see your this is a roasted fish here. Okay, and you could see your small rice here, brown rice. Okay, so your brown rice, you're going to provide you the fiber. You have your fish for protein, and you have your vegetable that's going to also give you your fiber in there. This rice contains, the brown rice also contains carbohydrate, but it's limited. So this brown rice at the same time is going to give you your fiber. It's a complex carbohydrate. Okay, it's a complex carbohydrate. At the same time, you're going to obtain your carbohydrate. You're going to obtain both your fiber and carbohydrate in there. So you can see how small it is. So you can see how small it is. You're going to eat more of fiber and less carbohydrate. I have a question here. I have two questions here from Haji and Susan. It says, Haji, let me start with Haji. It says, sometimes I feel my both side. Haji, I don't understand what it means. It says, sometimes you feel your both sides read, sweating. What is read? Haji, I need you to call. I need you to. This your question is not complete. It says, sometimes I feel my both side read. This is what I don't understand. Read, sweating. The Okay, ribs. That's what yeah, ribs. Okay, so if you both side of your ribs sweating, is your sweating excessive or what, or just a normal sweating? Are you having excessive sweating, or I just want to know, are you having excessive, okay. Now, one thing you have to understand, okay? One thing you have to understand is, if you have diabetics, especially people with type 1 diabetics, it also occur in people with type 2 diabetics, that they sweat excessively in the upper side, upper body. In their upper body, they sweat. Mostly you find them in people with type 1 diabetes, but it also occur in people with type 2 diabetes. So you find them sweat on their upper body. They sweat a lot excessively. But on their lower body, including their feet, they don't sweat enough. Okay, Haji, you have to understand this. People with type 1 diabetes, especially it occur on people with type 1 diabetes, but it also occur in people with type 2 diabetes. They sweat excessively in their upper body, but in their lower body, their feet, they're less likely to sweat, or they sweat just a little bit. But where they experience sweating enough is in the upper body. Now, why do you sweat a lot? Like, for instance, you say on your ribs. Your ribs is part of your upper body. The most common reason why you have that unusual sweating is that people with diabetes you have a low blood sugar. Okay, either you have your blood sugar is very low, or you have a related nervous system damage. These two things, because your ribs is in the upper body. So people with diabetes, especially type 1 diabetes, also people with type 2 diabetes, have that experience. They sweat a lot in their upper body. In their lower body, including their feet, they experience it less. Now, the two common reasons why you experience unusual sweating in your upper body is, when you start sweating excessively, it means your sugar level is low. Check your sugar level is low. Okay. And again, if you have a nervous system damage, these are the two common reasons why you sweat up in your upper body. So anytime you start experiencing sweating in your upper body, like in your ribs, either your sugar, check your sugar level, you see that there's a tendency that your sugar level is low, or you have a nervous system damage. These two key reasons. Okay, Haji. So first of all, check to see if your sugar level is low, because anytime your sugar level goes down, you're going to experience that sweating in your upper body. So if your sugar level is low, you have to boost it up. And you know how to boost it up. You have to find something that contains sugar to boost it up. All right. So these are the two key reasons why you experience sweating on both sides of your rib, because your rib belongs to the upper side of your body. All right, Haji, have I answered your question? Let's go to Susan. Did you understand what I said? So that I can answer Susan's question. Haji, you are not answering me. Did you understand what I just said? Okay, so let's go to Susan's question. Susan says, my sugar sometimes goes very high. I live in Plenterberg Bay, Western Cape, South Africa. You're welcome, Susan. Your sugar level is very, very high. Sometimes goes very high. If your sugar level sometimes go very high, there are reasons why your sugar level goes very high. The most common reasons is your dieting, what you eat. Your diet, what you eat, plays a role why your sugar level goes high sometimes. Now, your question is I'm trying to understand your question because it says sometimes your sugar goes high. Now, I'm going to answer that question in two different ways. Anytime you finish eating, I don't know if that is what you're asking, but anytime you finish eating, after meal, your sugar level is going to spike up. And that is why they say take your sugar level reading 2 hours after meal, 1 or 2 hours after meal, take your sugar reading. After meal, usually your sugar level goes up to 10 milligrams per deciliter. That is the max. Okay? So after eating, your sugar level is going to spike up, and later, once the sugar level starts settling down, it comes down to where it's supposed to be. So after meal, your sugar level are going to spike up. So if that is what you mean, but if it's not what you mean, so if your sugar level goes up sometimes, it depends on what you eat at what time. So maybe if you eat something that contains sugar too much, it's going to spike up your sugar level. Or if you eat food that contains too much carbohydrate, it's going to spike up your sugar level. So what you eat matters. The quality of the food you eat matters. The size of the food you eat matters. And the time of the food you eat matters. And what do I mean the quality of the food you eat matters? You must make sure you eat food like you see the food I posted you are seeing on the picture in there. You see this, how, that is the type of food you're supposed to be eating, more fiber. Okay? You're going to eat food that contains more fiber, like fruit and vegetables. Fruit and vegetables. Let me remove this and let me share another. Let's look for another. Okay. So you see this kind of food here. You see the kind of food in there? Those are the kinds of food you're supposed to be eating. More vegetables and fruits, because you need complex carbohydrate. Okay? So fruit and vegetables are going to give you those fiber that you need. And then you eat less carbohydrate. Don't eat food that contains too much carbohydrate. Stay away from food that are simple carbohydrate, like white bread, white rice, cornmeal food, cornmeal, cassava meal, all those type of meals, they are simple carbohydrate. They are going to spike up your sugar level. You're supposed to be eating this type of food. Okay? Brown rice, go for brown rice, brown bread, oatmeal, oatmeals, whole wheat, like wheat meals, grains, legumes. Those are the type of food you're supposed to be eating because they are complex carbohydrate. Okay? So you're going to eat fruit and vegetables that are high and less carbohydrate. So the type of food you eat at times will spike up your sugar level. So if you eat food that contains too much carbohydrate, remember carbohydrate is sugar. So when you eat food that has too much carbohydrate, when you eat it, when it goes into your system, it's going to convert that carbohydrate into sugar. So even though you are not adding sugar to your tea, you are staying away from sugar. Carbohydrate is also sugar. Because once you eat food that contains carbohydrate, once you eat it, once it goes into your system, it converts that carbohydrate into sugar. So that is why you have to eat carbohydrates small in quantity. So you're going to reduce your carbohydrate intake and increase your fiber intake. So the kinds of food you eat matters a lot. So you got to watch what you eat. You got to watch what you eat. And then the kinds of drinks. You got to avoid sugary drinks also. Avoid milk. Anything milk, all those things that contains too much carbohydrate and like milk contains a lot of sugar. You got to stay away from them. So that is why the kinds of food you eat at a particular time might have an effect in your sugar level. So that is why it says sometimes it goes up. But you have to eat these kinds of food and stay away from all those too much carbohydrate like cornmeal, milling meal, cassava meal. All those type of food are very bad for diabetes. All right, Susan, did I answer your question, Susan? Susan, did I answer your question? Brian, you got to stay away from mango. Whether it is ripe or no ripe, stay away from mango. Mango contains a lot of carbs and sugar in it. Stay away, whether the mango is ripe or unripe, stay away from mango. It's not good for diabetics. Brian. All right, Susan, try to watch your diet. Your diet plays a vital role. And then try to exercise. Drink a lot of water. Stop taking sugary items. Stop taking sugary items. Drink a lot of water. All right. Okay. My time is up. Do you have one more question before we go for today? And tomorrow is another day. My time is up for today. Do we have another question? Do we have another question? Okay. I have to go back to work now. I have to go back to work. I said, let me spend an hour with you guys. And this is 1 hour, 30 minutes. I'm with you guys. I have people waiting for me to attend to. So let me go and see. Those are waiting for me. So now, please make sure you get hold of your diabetics. How many eggs? One. One egg is okay. One egg is fine. Okay. All right. So friends, I'm going to let you guys go now. I have to return back to work. I said, I have 1 hour free time. I said, let me squeeze in 1 hour with you guys. And then I'm already 1 hour. I have people waiting in the waiting room there. So I have to go attend to them. All right. Tomorrow we're going to meet again. I'm going to try to, tomorrow we're going to meet for another live video. Keep watching the videos. Keep sending me your questions. I'm reading your comments. Okay. Gradually, I'm going to try to cover the areas. All the areas. You guys should have for tomorrow, write your questions down, keep them ready. So when I come back tomorrow, so that you have your questions ready to roll, and then you can get in your questions to be answered. Okay, so keep watching the video, keep doing whatever you are doing. Make sure you are following your doctor's instructions, and then avoid allowing your sugar levels to creep up. Make sure you are monitoring your sugar level very well. Eat healthy, exercise, drink a lot of water, stay fit, reduce your calorie intake. Make sure you are doing those things doctor advises you to do. Follow the rules and regulations of diabetics, and then you're going to live a normal life. And then take your medications. They are very important. If there's any side effect in your medications, return back to your doctor and discuss the side effect with your doctor. It is your right. Okay? Build a relationship with your doctor. Very, very important. It is good to build a relationship with your doctor. I'm not talking about the relationship. I mean a professional relationship, doctor and patient relationship. Okay? Open up to your doctor for any side effect, anything that is going to, so doctors know how to treat you. Okay? I'm here to guide you guys along. So keep sending your questions, keep watching the videos, and then invite your friends to the community, and let's see what we are going to discuss. So thank you guys for today. People are waiting for me, so let me go and attend to them. Thank you guys for today. I have to rush now back to office to finish up. So I'm going to see you guys tomorrow, same time. Stay blessed. I love you guys. And then good night. Goodbye. Bye-bye.